Welcome back to our podcast, Real Talk, Mind, Body, and Love. I am Dr. Kelly Frank.
I'm Dr. Leslie Worth.
And today we're going to dive into, I think, what kind of brought us together, which is like pelvic health and sexuality.
Right.
Yes.
The merging of the two.
So I think we'll kind of do sort of the first part, I think, is more of like a little recap of like what the idea of just pelvic health, like clinically.
Right.
You know, when I meet somebody, I definitely ask about like, you know, how is intercourse? How are speculum exams? If you're having anal intercourse or whatever kind of like form your pleasure is, like, does it hurt?
Mm-hmm.
Does it feel okay? Do you enjoy it? Like, at what point does it, you know, start to either get dry or uncomfortable or whatever? And then usually that kind of like, if we go into these different tangents, I will quickly kind of revert to like, you know what, if you're not talking to kind of like a mental health therapist, I'd really recommend that you seek a sex therapist or another mental, you know, therapist that specializes in this, because I can take you the clinical route.
Right.
We can work on the actual tissue health, you know, like, does it have good blood flow?
Right.
Is the nerve, you know, not being like hella angry or just, you know, shrouded and like you can't even feel it.
Are the muscles so
you know,
tight? That...
Are the muscles working correctly?
Right.
Like, I can kind of take you there, but then I do so much better and they do so much better when I have like a counterpart to kind of like do the things that it's out of my scope.
Right. I think we originally met because I was seeing with my clients they've been working with a pelvic floor therapist, and clinically speaking, they're seeing progress. Like if it's like vaginismus, like they're making progress with dilators and great progress with their PT. And then they get with their partner and all that goes out the window. So it's like, well, yeah, you want to have the progress not just in the exam room or just with self, but how do we tie that work into the partnership and sexual intimacy?
Yeah, the intimacy part. Yeah,
and join together, because I don't have the knowledge about the tissue health or that stuff. So that's where it's like, you know, someone's coming to me, I'll be like, well, physiologically, we got to make sure.
Yeah.
You know, yes, a lot of things can be psychosomatic, but doesn't mean that there's not actually something going on.
Like physically wrong.
So that's where it's like we came together. It's like, oh, we kind of balance of like our knowledge bases together.
Yeah.
And like with pelvic health on intimacy level, it's like we want to make sure there's no pain with sex. Unless
you want it.
But like just a penetration or just touching the vulva or the labia shouldn't be burning or excruciating or anything like that. Or with my guys, I'm like, they're feeling like you have to like really try to insert. I'm like, we don't need a penile fracture.
Yeah.
Like if it's not going in.
Yeah.
Don't force it. And going back to what we were saying in our last episode of just like, there's so much that we just don't talk about. So if this has always been our experience, if sex has always been painful, then we might just think that's how it is.
Yeah.
And
until almost like one day it's not. I've even had friends who they've had kids or something kind of changed in their lives, and they're like, man, like sex is awesome now. And I'm like, oh, okay, great. Like that's, you know, like they kind of figure out what I do, and that's kind of why we're talking about it. But I'm like, that's great. I'm like, wait, was it not?
Right.
You know, and then I'm like, oh man, like you had, you know, like that sucks.
Right.
You know, or like you do have a kid, and if there are tears or there's like a lot of trauma associated with that, and then you're like, but I really want this so-and-so to have a brother or a sister, and I want to expand our family, and like you kind of just like, you know, put on your helmet and just go after it.
No.
And then like, that just sucks.
Right. Or I tell people, like, do not grit through it.
No.
Like, this is not like, this is not like a job interview where you're just like, I just got to get through it and maybe it'll pay off. But it's like going back to what we were saying in our very first episode, like if our body's giving us pain messages, it's trying to get our attention.
Yeah. But we're really good at suppressing that. We're really good at like, lots of, you know, little alarms are kind of like ringing off. And I tell patients that because it's like they might end up finding you or I when it's just like the wall has hit. Like we are, this is, every alarm clock has been ringing, but now this is like, I'm going to physically stop you.
Right. Or like with mine of like, if they change partners and their partner's going, because I've had that where females come in and they're like, I thought this was normal, but I'm a new partner saying like, I don't want to hurt you.
Yeah.
Like there's something probably going on. So I like how you say, like, just because it's common doesn't mean it's healthy or normal. And there's so much that we don't really talk about with pelvic health. You know, with people with uteruses may go for a pap smear now with once every 2 years, I think they changed it.
Yeah,
you
it
know,
can be a while.
And guys, like, do they ever go to the doctor?
No.
So there's a lot that could be happening that they're not even aware of. But going back to what we were talking about of, like, how do we get the work you're doing clinically with a patient, how does that translate into their sex life? Because that can be a lot of frustration or anxiety. Because I talk a lot too of just, like, especially if it's like a woman with, like, vaginismus, I'm like, well, yeah, you trust yourself to know when to stop because you're getting all those internal cues, but now you're trusting your partner, and we have to really work on, like, how do you feel comfortable to speak up,
right?
When
just
it's
the communication,
like, change the angle or not so fast or whatever it is. And that's where I see a lot of people slide back of, like, well, now I'm having to trust another person, and I'm like,
I think that also boils back down to, like, just like that bodily autonomy of just, like, if you fully understand kind of what's going on, like that vaginismus is just basically, like, almost like the vagina's like Venus flytrap, like, just nobody's coming in, like, this is just hard,
none shall pass.
Like, just absolutely not. But if you instead of that, also kind of like, and this might, like, segue into our next, like, sort of topic of just, like, that might be, like, a desirable thing for, like, a vagina to be, like, super tight and, like, tiny and, I don't know, cute or whatever, and it's like, no, I mean, it should kind of move, it should kind of grow, and there should be blood, and there should be, it's active,
well, it should elongate when we are in aroused state.
Yeah.
And, and it's, I always tell my clients too, I'm like, it's geometry. Like, we're trying to get the parts to fit together.
Yeah.
And based on curvature of the penis and your vaginal canal, how deep it is, or whatever, or how your uterus is tilted.
Sure.
It doesn't sound sexy, but a lot of times I'm just like, it's geometry. Like, we got to figure out what positions work for you.
Yeah. But then it can also, I mean, the vagina, it can change so drastically over the course of our lifetimes and, like, different moments or anything like that. And, like, then it has the ability to, like, heal. It has the ability to, like, expand. It's just, like, it's incredible.
Right. But then I know you probably have to battle this, like I have to battle it, of, like, societal messaging.
Yeah.
Of what it's supposed to either look like or feel like or be like and
smell like.
Yeah, douches, like, why
Sparkles,
are those still a thing? I don't understand, like, your pH level is fine unless you're having issues. You're not supposed to smell like daisies.
Nope.
Down there.
Nope.
I'm pretty sure.
No. Don't need to put things in it. Don't need things to get all up in it and clean it.
Right.
Or even just, like, on the outside too.
Like, it's really good at cleaning itself. Like, it's
pretty good.
It's a pretty well oiled machine down there.
Regulated.
Yeah, but no, so all the societal messaging. So we have, like, just from the education standpoint, like, we talk about abstinence only is usually the only teaching that we get, right? So it's don't have sex until marriage, potentially.
Probably.
But no guidelines of, like, okay, well, what does that look like? And then it's really still heteronormative of
or even, like, sex,
penis
even
and
just,
vagina.
I think even, like, the act of just sex being, like,
tab A slot
into B. You know what I mean? Like, versus, like, I think it's, like, more than that, right? Like, sex is obviously more than just that.
I would hope so, because that can be kind of boring. So, but yeah, it's like we don't give them the proper tools, or even just, like, lubrication or what the changes happen or any of this. So it's like there's these teenagers that are probably having sex at some point because biologically hormones and stuff like that's happening, but they don't have any tools to really understand unless they're going to, like, pornography.
Sure.
Right. And I always tell my people, like, the angle is good for the camera.
Yeah.
Probably not that pleasurable.
Yeah.
And that doesn't go over consent or any of these things. And also, like, what I'm supposed to look like.
Right.
Of, like, it's supposed to look like this one particular way.
Yeah. Yeah. Like, it's all not just, like, I mean, it can be, like, I guess, I don't want to say neat and tidy because it makes it sound like if it's not neat and tidy, that's wrong. Again, it should feel comfortable.
Right.
It should feel fine. It should have blood flow. It should provide you the ability to pee, to poop, to allow entry if you need entry. should be able just to function.
Right. There's no correct way of
how it looks. Yeah. 'Cause there's no correct way of like how you and I are supposed to look. Like, should I be having glasses? Should I have black hair? Like, I don't know like what's the correct way for me to like look and like act as a human. Like,
I think we're battling that too, because it's just like with social media.
I was going to dive into like, I don't want to dive into AI. I'm so scared of robots. No. All my patients know that I'm so scared of like robots and AI, but I feel like that's even probably scarier because now like if you are seeing like so-and-so influencer, are they even real? I don't know. I'm not, that's the end of my conspiracy. I'm done. Right. I'm done.
It's
Walk away.
The shift that we've had, right? 2 years ago, we would have, never questioned if this was a real person or not, right? But now we are susceptible to that.
And even if it's a real person, do they have a filter on? Do they have,
right.
Photoshop
was there
around
editing?
Forever?
Like you mentioned, like for pornography, like, is there editing done, or is this all like one logical take?
Right. Or what else has been in there? So it's So we have the extreme, and this is where I see with clients too, of just like they have these mixed messaging of just like, so I've been told like don't have sex, but then not everyone, but most people are like, it's in this nitty gritty dark corner where pornography and this is what you're supposed to do.
Yeah.
So, but we're never really just honestly talking about like sexuality and sex and intimacy as like from a pleasure standpoint, and why are we doing it, and what's, of like, there might be some people with pelvic health issues that they can't have penetrative sex.
Yeah.
And so it's like, if we only think of tab A into slot B as sex, then that person's going to feel very downtrodden and that they can't have a sex life.
Right. Yeah. Or they can't be intimate and they can't have partnership. They can't have, other things that they kind of need.
Exactly. So it's, I think we're getting to the point of, with all this messaging out there, it's like the average person is just going like, well, am I normal?
Yeah.
And we know you and I hate that word because normal is just what you're used to. But we want to talk about what's healthy, what is fulfilling, what is how you want to live your life, and consensual, and all those things. And I think that's we're going to lead into part 2.
I think so.
Right?
That was really good. Yeah,
you
did a great segue. That was really
good. What a flow. That's so nice.
So stay tuned on learning of what's healthy.
Yeah.